most famous physical therapist on the internet.
Hi folks, I'm Bob Shrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show you how to perform traction for neck pain or pinched nerve without equipment, if you call a towel, no equipment. 60 seconds and it's going to decompress your spine, especially the neck. So neck traction may be appropriate for a pinched nerve or disc arthritis. Somehow the nerve is getting pressure on it.
Right.
And so we're going to show you a couple ways. Now, you should make sure this has been approved by your doctor or therapist.
Right.
And we would almost suggest, Brad, too, that you might want to watch our video, the #1 stretch and exercise program for neck pain or pinched nerve. That's the McKenzie program.
Oh, sure.
You may want to try that first before you even do traction because you
Right.
might not even need it.
Sure.
And we'll tell you how to get to that program, or that video at the end of the.
Oh,
this
okay.
one.
Yeah, we'll
Okay.
direct you.
Yeah, we'll direct you. So to determine if traction is even going to help you, we're going to have you try just two things. One, we're going to have you do compression. So we're actually going to have you lock your fingers above your head like this, and you're going to press down gently, but you want to see if that actually increases your symptoms.
But before you do that, make sure you're not slouched.
You want to be in
'cause
good posture.
There's a good chance you're slouched naturally because a lot of people are. Let's put it that way. So make sure a firm chair is probably good. Good posture. Head and ears over the shoulders. You're not going to compress like this. We're going to go like this, and I'll both hands. I'll put it here, but I'm going to press straight down, and you don't have to push real hard. It's really kind of hard to, anyways, on yourself. I know when I do this to a patient, I do not put that much
I do it
pressure
gently
on.
too. The same with me.
It doesn't take that much if it's going to trigger the pain. So if that triggers the pain, that's positive. You don't want to keep pushing on it. Then you're done.
Right. We know then that compression makes it worse. Now we're going to find out if traction or distraction makes it better.
Mm-hmm.
Do you mind bringing Sam over real quick here?
Well,
He's
Sam.
all taped up, isn't he?
Well, Sam, why? Why the tape?
So-
Well, we'll work around it.
So if you look at Sam here, and I don't know if you're going to be able to see this real well, but he's got two bumps here. These are the mastoid processes
Yep.
right there. Do you see that? Got that.
Right
Okay.
behind. They're right behind the ear, and you'll feel them. They
So
stick out.
You're going to put your palm so that bump goes right between the two meaty points here.
Should I take off?
Yeah,
now?
why don't you take off? So Brad won't be able to talk now. So he's going to put it, right there and right there, and he's going to cup over his ears. You can actually go over the ears, Brad, like that. There. You don't like that, huh?
Well, no.
Your ears are too far forward. That's the
I got
problem.
big ears.
Yeah.
It runs in the family.
Okay, so you're just going to, in that position, head up towards the ceiling with his fingertips. The fingertips are straight up. He's pushing up. And what you want to just see, does that give you some relief? Does it decrease the symptoms? And if it does, you may want to try some of these then. You may want to try the actual traction. So let's start with the first one, Brad. So you're putting your elbows like this. You're doing that cupping like we talked about. And then with that in place, you can actually lean back. And you can have the head bent forward a little bit. Brad. Yep, bent forward a little bit. And you can really put some pretty good pressure on there. Is that correct, Brad? Yeah, he's telling you to keep the low back arched so they're not, that's going to help keep the neck in a better position too. But you can really put pretty good stress on, pretty good distraction on there. We're going to have you do these like for 15 seconds the first day, just 15 seconds. And then if it was okay, the next day you can do 15 seconds times 3. And then if that works out okay, the third day you can actually do 3 times 15 a couple times a day. You can do it throughout the day. Right. If it irritates at all, you don't want to do it. Okay means it doesn't make it worse or it even makes it better. Ideally, it makes it better. Otherwise, why even do it? Right. So it should take away your symptoms. Now, we're also going to show the exact same thing with a towel. So basically, you're going to use the towel to capture the mastoid processes. Those same bumps. He's catching those, and then you can go straight up, palms kind of up like this, Brad. Yep, there you go. And that Yep. Look, he can apply the same pressure.
I'm not looking up.
Yep. He's bent forward a little bit.
Can't go too forward.
Yeah. 15 to 20 degrees, and you just need a little bit of flexion. And now, if he's got pain down, let's say he's got pain down his right arm, he's going to actually, he could try to do this with one hand, and that's going to be a lot more comfortable, and it's going to be better for that arm. So again, you're looking for decreased symptoms. Same things. You do it for 15 seconds the first day, and I don't want you to do it more than once because you want to see how you tolerate it. The next day, you can do it 15 seconds 3 times in a row. And the third day, if it goes okay, then you can start doing, 2 to 3 times a day, the 15 seconds. If you're getting pain down the arm from a pinched nerve, ideally what you want to see is that the pain the furthest away starts to improve first. So like if you're doing the traction, if the pain starts going up the arm and leaving the forearm, that's a good sign. If the pain travels all the way up the arm and leaves the entire arm pain-free, that's even a better sign. Now, for some reason, if the pain got worse in the arm and better in the neck, bad sign. You want things to get progressively better as they go up.
If you happen to get dizzy or lightheaded with this, you're done. You do not continue. That's important because there are some arteries that feed the brain that could be getting occluded. I've never had it happen, but it's possible.
Yeah, it is. I kind of usually check for that a little bit. But
sure.
The last thing, you can actually do that towel thing again. And while you're doing it, you can actually, if your pain is on this side, you can tilt your head a little bit while you're doing it, away from the pain. You tilt the pain away from the pain, and that gaps that side a little bit so that it actually gives the nerve a little more room. So see how Brad just turned to the side. That means he has pain on this side. He bent away from it, just slightly turned away from it, bent away from it. And you want to see if this helps decrease the symptoms. It's just another thing to try. While he's getting his mic back on, this video, by the way, is a part of a series of videos on neck pain. So we had initially mentioned a video you could watch, #1 stretch and exercise program for neck pain and pinched nerve. Go to bobandbrad.com, go to the program section, look for the ones on neck pain. There's probably 20, 30 videos on neck pain. Watch the ones that you want to, feel that are pertain to you. Especially, like I said, watch that #1 stretch and exercise program one.
Sure.
And Brad, do you want to take it from here?
Sure. So after you've watched it, looked at the exercises, on this one you may want to go back because the mechanics of these have to be done. Again, pain-free. It should improve the pain. If it makes it worse, you're done with traction. You're just going to skip that part.
Yep.
But you can get a PDF printout with a review of the video, print it out, and then you can look at it and review it without going back at the video and watching our faces and our explanations and our babble. So anyways.
But it'll help. You might want to have both. You look at the video again and
right.
look at and
write some notes down on there that help you out.
Yeah.
And all this is done for you. There's absolutely no charge. We do not even ask for your email. You won't get bothered by us.
This is our gift to you.
That's right.
Hopefully it helps. Please leave some comments below if there's anything that we're missing or if you think this is helpful.
We'll keep babbling.
Yeah, we'll keep babbling.